welcome to Behind the Dean's Desk, conversations from the College of Graduate and Professional Studies at the Chicago School. I'm Dr. Alicia DeWalt, Dean of the College of Graduate and Professional Studies. This series is designed to highlight our community voices, ideas, and professional impact that shape our graduate and professional programs. In each episode, we step away from formal titles and curricula to have a real conversation about the work we do, why it matters, and how it connects to practice in the field. All right, well, welcome everyone. Today, I am so happy to be joined by Dr. Rodney Harris, Associate Professor in the Counselor Education and Supervision PhD program. His work truly bridges counselor education, community advocacy, and suicide prevention, creating innovative ways to expand access to mental health support beyond that traditional clinical setting. Through community partnerships, virtual clinical training, and grassroots innovation work, Rodney is truly helping future counselors connect to learning with real-world impact. So happy to be able to have this conversation with you today, Rodney. I've been such a cheerleader of the work that you're doing, and to be able to share your story and what you've been doing in the community, it's going to be a fun time together. So welcome.
Thank you. Thank you.
You're welcome. Rodney, I would love for us just to kick off on how you got into the counseling field and why higher education.
Yeah. So originally, actually, Alicia, I was going to go to law school, and my grandmother died. And so after my grandmother died, I decided I was going to take a year off. And during that year off, I decided I wanted to take a class at North Carolina State University. And the only class open was a counseling education class at North Carolina State University. And I went over and I started to take that class. And I met one of my mentors at the time that was there. And she told me, you are good at this. And you should really consider you should really explore becoming a counselor. I was like, I'm going to become an attorney. And she was like, you really should consider this, and I will help you get into school. And I started thinking about it. You know what? I am good at this. People have always, I've enjoyed psychology. My undergraduate major was psychology, and I should consider it. And so I did. And that kind of started the wheels turning. I ended up telling my mom, who wasn't happy at all. But eventually, I was able to convince her, and that started the door opening, and I was able to go into counseling and eventually go into higher education.
That's fantastic. I'm always such a firm believer that things work out the way that they're supposed to, right? Those things happen in our lives for a reason.
Yeah.
Rodney, I'd love for you to, before we dig into the work that you do, kind of set the stage on the program that you're in. What are the career outcomes? What students are best suited perhaps to be in the PhD program?
Yeah. So career outcomes, I think particularly students that are looking to become professors, master counselors, and for me, researchers. And so this application of research and particularly community engaged research. And that has really become an interest of mine in the last days. So counselors that have been practicing for at least, I would say, 3 to 5 years, and that want to teach and that want to explore research. I think this is the ideal program for them, and particularly want to learn more about distance education, virtual learning. This is the program for them that will help build them and help them develop those skills to teach virtually.
Thank you so much. Well, Rodney, I really want to dig into the advocacy work, the community work that you do in your role. What does advocacy look like to you when it moves beyond those traditional clinical spaces? Can you share some insights there?
Yeah. Yeah. So one of my mentors a number of years ago, her name is Betty Murchison. When I was working in community mental health, I had a very sterile, clean office. And she came to my office and she challenged me about going outside of the office. And she said, "You look good in this office, and you look good doing this work." And she says, "I want to challenge you on what you're doing outside of this office." And when she left, it bothered me, Alicia. And I was like, no, it's like, what does she mean by this? And it bothered me so much. I was like, what else can I do? I'm seeing all these clients, I'm doing all this work.
Mm-hmm.
And she said to me, she challenged me about going into community and community engagement, speaking up for those that can't speak for themselves, going to meetings and stepping outside of very sterile, clean environments. And I started doing that. I started going to community meetings. For me, I started going into my barbershop. It started to look like someone had a heart attack at my barbershop. And after that person had a heart attack at my barbershop, it was, what can I do about it? An actual person had a heart attack and died. It was like, okay, what can I do about particularly Black men that were dying and high blood pressure? And what kind of advocacy, what could I do about that? And so I went to my barber and said, what can we do about this? He was like, you tell me, we'll partner. And I started to develop a program around Black men, mental health, and particularly men and particular blood pressure. And I got some friends of mine that were nurses to come to the barbershops, and then a group of barbershops. We started this quarterly program where we targeted a number of barbershops, and we recognized that men do not check their blood pressures. And then we got some partners with hospitals and nurses. And we realized the barbers weren't checking their blood pressures. And so we realized that that was an area of advocacy that we needed to speak to. And post-COVID, we started partnering with physical health and mental health, recognizing that it was easier for us to begin to do some work around depression and anxiety. And so that was one of the ways we were able to marry those, and we were able to do some advocacy work and really start to speak to both of those, using the barbershop as an intervention point to be able to speak to physical and mental health.
Wow. And it goes in such alignment with what our mission is at the Chicago School, right? Certainly with us opening up our new Doctor of Osteopathic Medicine program and integrating the mental health and the physical health together, and to be able to do that in your community in such a way that came from a need identified in the community and partnering together to meet that need.
Yeah,
That's really impactful. Can you
yeah,
speak to, Rodney, like what have the outcomes been? It sounds
yeah,
like you continue to bring in more
yeah,
barbershops, build a larger
yeah,
community. So certainly a need. Can you share
yeah,
more about like what outcomes you've
yeah.
seen in that work?
Yeah, let me speak to one other thing. So this whole
Yeah.
idea of community engaged practice, so that model was actually a model that, when I first started working at the Chicago School, and, I started to ask, at the time it was the chair was Lorianne, and then it was Susan Foster, what does community engaged practice look like? And, does the Chicago school mean that I can go into my community? Is this what they're meaning for me to do? And so it's like, yeah, that's what they mean for you to. That's a model,
Yeah.
community engaged practice. And it's like, oh, so this is what they want me to do. Then let me do this. Let me do this, and tell me when to stop. And so,
Don't stop.
yeah, 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 yeah. So that's exactly what it was. Then so the other piece of what I did is I began to write some of my grants around it. So ways I could support the work. So I wanted to make sure I mentioned that. And so
Yeah.
what it's expanded into is, so one shop heard about my work, and then other shops was like, can you come by here and, can you get some of the other nurses? Can you get more nurses to come by? And so we started doing that. And so what we recognize is, and then we recognize that we started to partner with Blue, particularly for us, it was Blue Cross Blue Shield, heard about some of the work that we were doing, and they heard about the numbers that we were, men that were going to the emergency room. And we, at times there were, 200, within that quarter, there were 200 to 300 men, blood pressure screenings that we were screening within that quarter. And then sometimes it was up to 500 men. And at times we were sending men to the emergency room. And some of the nurses were calling wives and saying, look, you really need to get your husband to the emergency room. I'm a nurse who's working in the community. Your husband has a blood pressure issue. You need to do something about it. And so, particularly building community and saying there's something that we want to do about this. And so we had this whole idea of community capacity, this whole idea of following up and being able to do something about that. And so on one level, we started to do that. And then on the other levels, we started to do some of the mental health work. We gathered the attention of something at the University of North Carolina. It's called the Suicide Prevention Institute. Through the School of Medicine. And that is a wonderful entity, organization. And so what they did is they said, why don't you offer PHQ-9s and GAD-7s, as you're going in the community and you're doing work. And so we started to offer those when we were going in the community and we were doing work at the barbershops. And then expanding some of the work and expanding this whole idea of what a brave and safe, and now, as Dr. Foster, these third spaces, what a third space looks like as we look at a barbershop. And now I'm applying this use of a third space into skate parks. I'll speak probably to that a little bit later. As I'm applying this use of expanding the use of a third space into other spaces. And so we're getting these numbers. At our last barbershop program, we had over 500 people at our last event at the barbershop. And so I got Blue Cross and Blue Shield to sponsor and provide 500 free haircuts to the community. And so we had over 25 barbers, community barbers that came together. We were able to give over 250 blood pressure screenings. They were able to, 442 men were put on blood pressure plans. They were followed up by a case manager. And so it's not like we come in and check their blood pressure. Blue Cross has said, we want to follow them, see how they're doing, and we want you to do these a little bit more periodically to monitor their blood pressure, to show that we're invested in them. And so it's kind of taken off, and they're saying not only that, this year they've asked us, we want you to take it to different parts of the state. And so there are different parts of the state that they've asked us to take it into a couple other communities. And so I'm taking some nurses with me to these mobile shops, and some nurses and some some therapists, and the barbers. I always take the barbers with me. And my barbers, I've trained them in calm and mental health first aid, so they know the language capacity to speak. And so I'm a mental health first aid and a calm trainer. And so I train them at giving them capacity to speak the language. And I don't know, we also, we give out gun locks. And so we give out gun locks and Narcan. We give out Narcan. It's a wonderful Narcan story. Remind me, Narcan, that we're saving lives around that. We've distributed over 2,000 gun locks into community and done some wonderful work around Narcan and saving and transforming lives in community and saving lives in community.
Absolutely, saving lives. Okay, so Rodney, I'm thinking back then when we talked about with your early career days, right? In your sterile office and that feedback. So talk to me about how you felt then, about what does it mean to be out in the community and doing more work, and how this work has shifted your thoughts on access to care, counseling skills, being in the community. How's it shifted for you?
Yeah, it shifted my mindset as far as, particularly as I look at disparities and health disparities, particularly in Black and Brown communities, and particularly in low wealth communities. And that's something And it's always been of concern to us, particularly at the Virtual Clinical Training Center and some of the work that we've been doing there, and
Mm-hmm.
recognizing how this impacts clients and how this impacts our community and how we see this in our day-to-day life. And so that's kind of shaped that. And then also being in community to see it and being able to develop interventions that are transforming lives, that are touching people, and also to teach other therapists how to do this and what this looks like. As I'm implementing these programs, as I'm saying, don't sit back and do nothing. Let's do something, and then let
Yeah.
me give you some data to show. Let me give you data to show how you can change. Where to go. Like data informs. I just don't wake up and say, okay, I'm going to go to this community. Data informs the
Right.
17 counties that we target in North Carolina. There's 17 counties that we target, and we use that data to inform where we go and where we develop our interventions, where I hosted my conference. And so, using that data, and I use that data to show my students. So this is how I'm doing this in North Carolina. And they even helped me design some of the interventions and where we go and design some of the programming. And so when I think about then, it was, what do I do? How do I do this? And then it goes to thinking about it, from theory to practice. It's the
Right.
practice part of it. It is, thinking about it to doing it. It is from
Right.
developing the intervention, thinking about what that looks like, to let me do this. Let me do this. And sometimes in practice, we never know what the intervention is going to look like. You don't know how it's going to work until you practice, until you put it into action. And so this is just the praxis piece of that.
That engaged practitioner model, right? You're bringing
Yeah.
that to the classroom and then providing our students opportunity to really put those skills to work, to really think through, right? From beginning to end and how we're going to support a community. I think about, Rodney, when you say the intervention piece in the community, I think from hearing your story and the work that you're doing, it's grown because there was a community need and the community was involved in supporting that intervention or figuring out what that intervention looked like. Do you agree? Were they like brought in and trying to figure out what the needs are and having that feedback loop?
Yeah, Alicia, that's so important, when you go in the community. I think about some of the work that I've done in a community called Rocky Mount, North Carolina. And the first piece of work we did in going in that community was we designed these listening circles. And so
Mhm.
one of the ways I describe to some of my students and some members of the community is like, you just don't go into a community as an unwelcome guest.
Right.
You let them invite you in, and you sit down and you listen to them, as an outside group that's coming in. And we were an outside group of researchers coming in from the Suicide Prevention Institute, Chicago School, a bunch of stakeholders coming in to want to
Yeah.
host this conference, and, sometimes you have to convince the people that, number one, we can trust you, and that we are invested to help you. And so that was a beginning of the capacity part of the work, gaining that trust, just like clinical rapport. It's
Hmm.
basic Rogerian. Let me build this trust. Let me build this rapport. It's all about the relationship. Let me
Yeah.
build this relationship, particularly in Black and Brown communities. That is so important. And so, just that was important to us as we started to do this work, as we decided to design these interventions and go into that community and design this conference, that the state had asked us to hold. And so, yeah, that was the beginning of the capacity work, identifying the stakeholders, identifying who the partners were. And, we learned some valuable lessons about what the community told us about, where to go, who to include,
Right.
who
Yeah.
wasn't there, who you need to bring on a board.
Hmm.
And, they told us, you're going to this place, you really need to go to this place. You really need to consider this person. And And that those are some valuable lessons that we learned, as we got the right people at the table to help us to host this conference and help us to develop the interventions to hold a successful conference.
Yeah, talk about developing relationships, building rapport, and outside your sterile office. I just keep having this image of you, Rodney, just being in this office now, because I can't imagine you in any other place other than in your community and with your students. So that's wonderful.
Yeah.
Can you tell me about the skate park work that
Yeah.
you're doing?
Yeah.
Is this more, I think this is more recent, correct? I know
Yeah. Yeah.
yeah, this is a new one.
It is a new one. It's called 988 and Skate. And so it was developed. So, first we were doing the barbershop. I mean, we're still doing the barbershop.
Right.
And my barber and I had this idea, and we were like, okay, we want to reach youth in a different way. And so I'm working on I helped develop the North Carolina 5-year state Black youth suicide plan. And so after developing that, I started thinking, what are some other spaces? What are some third spaces that we can intervene with, youth? And I started thinking, I rode past the skate park and I started talking with my barbers like, that's an interesting spot. There are a lot of different types of people that hang around a skating park. And then so he said, well, why don't we look at hosting, an event there? And then, again, the alignment of meeting the right people at conferences, and then all of that kind of line. And then there was this heavy push for 988. Educating. We identified a region where there was low usage of 988 in the area, and they wanted us to increase 988 usage. And so we were like, okay, why don't we target some youth groups, some churches, some barbershops to see if we can get youth out, blanket them with 988. Barbershops, get DJs, food trucks, get some step groups out, DJs, do all of that. And so we did it last year. Got this phenomenal response where we had 350 kids, all different types of kids from all over, little kids riding bicycles, people on skateboards, parents, from all walks of life. And then, of course, Blue Cross came and they support a lot of interventions, all about relationships. They support. Blue Cross sees this, they're going to think I'm supportive, but they support a lot. They believe in a lot. They believe in a lot of my crazy ideas. And so Blue Cross heard about it and they were like, okay, yeah, we like this. We like this intervention. And so they said, okay, we'll support it. And so they gave me some funds. And really the funds were about me paying for the barbers to cut hair. Because if they don't work, if they don't, I have to be able to pay them. Right. And so another piece of advocacy was that, Alicia, I want to be able to pay them. They can't cut for free. And so give me some money to pay the barbers. And they were willing to do that. And so now that, I'm able to pay them, they are right up there, like Dr. Rodney, Dr. Harris, wherever you go, we are with you, get us these, we will go with you, because I gave them the language, the capacity to speak to mental health. They're trained, they know what to say, and now I can pay them to do the work. So they're like, okay, Dr. Harris, we're ready to go. We are ready to go in the community. And so we just see the aftermath of the kids saying, we like this. And there's another piece. We do this art piece of it. There's an art piece of it where, this cool vibe. The kids are, we have this expression wall. They're painting on this wall. They're skating. There's music. There's food. There's people stepping. It's just a very lively, good atmosphere. And we got 988 materials. There are therapists around. And we've seen that kids are being able to respond, and we've seen 988 usage, particularly in that community. We've seen it skyrocket, and we want to be able to take that to other areas of the state. And the state, we have their ear; they're listening to us about this program. They're watching, they're listening.
That's fantastic, and what a critical need for that population. I wonder, Rodney, what are some of the most urgent conversations we should be having around the youth and suicide prevention, especially in Black and Brown communities? What would you want to share with those listening?
Yeah. particularly something that became a concern for me as I think about advocacy, Alicia. A couple of years ago, we noticed that the rates of Black youth suicide was increasing at a faster rate than any other
Mhm.
population. And so when we noticed that, we knew that we had to develop some interventions. We had to intervene in our community quick and fast. And so that was why some people ask me, like, why Black youth suicide? It's because the rates are increasing at
Right.
an alarming rate. And so we knew that we had to develop some interventions, and we had to get in our community. That was one of the ways, that was something that we had to do. And in North Carolina, we utilized the data. And so a couple of things we paid attention to. We paid attention to the kids that were going to the emergency room. These were kids that were going to the emergency room with self-harm, or they had behaviors that were indicative of, it was more than just, I'm going to harm myself. There were behaviors, self-harm behaviors. And then we also kids that have actively been lost to suicide. And we combined that with 988 data. We identified these 17 counties in North Carolina, and we said, we're going to target these 17 counties. These are the places that we're going to start our interventions here. So what we do every year, we start out with one county, and this is based on some funding. We start with one county, and then we put the information into this data analysis with UNC. Then they give us the next county, and then we try to partner with different organizations, what kind of funding we might be able to secure. And then the other piece that's really important, let me make sure I mention this, is the barbers. The barbers have their own community. Like, I wouldn't be able to just, it's their own hidden population. The
Right.
reason I'm able to go into barbershops is because my barber knows other barbers, and he knows all the barbers throughout the state of North Carolina. They have their own community. They have their own brotherhood. I'm able to access that population because of him. They know me because of him. I'm able to go there because of him, and they take care of each other, and they allow me to go in their shops. And so when I have my trainings for my calm and my mental health first aid, I don't have to do any recruitment. He gets them there for me. And so my trainings are full because he's already made the phone calls. He's already made the contact. Only thing I have to do is show up. And he has all of it. He usually secures the location with the community college. We also have partnerships with community colleges where we train upcoming barbers. And so I wanted to ensure that I kind of spoke to that. So that's been an important part of the work, that's done, and me being able to continue to do the work. I wanted to make sure I wouldn't be able to do that work without that relationship and building the capacity around that.
Thank you for bringing that forward. And thank you for all the work that you're doing in your community. It's certainly just so inspiring. So thank you, Rodney. I think the last area, Rodney, we haven't talked about is the virtual clinical training center and the work that we're able to accomplish through this type of innovation, both in connecting with communities, but also helping to train our students in telehealth. Can you share what that looks like on both like a student side and then how we're working in the community through it?
So we have a number of partnerships through about 4 community organizations, and one of them is Casa de Jose. And what we do is we form these partnerships with them, and then we have clients that come through, and we are able to provide counseling to them. And actually, one of our organizations, through some of the work that we do in community in North Carolina, we have a partner organization. Some of our clients that we see in community, we're able to screen them, and if they fit a certain criteria, and these clients that we see in community, we're able to see them. Another way our clients are able to get seen is sometimes they're in community, folks that are coming through our partnership that we have with our SCARS program. And so those are students that are coming through military adjacent and military students that come through. And so those are a number of ways that our students that are mainly in our PhD and our mental health, clinical mental health program, are able to see clients and are able to accrue their counseling hours under the supervision of a couple of our clinicians, and myself, Dr. Scott Lip, and some of our other staff are able to provide there. So our students are able to see clients, and they're able to accrue their hours and get real practical world experience, and also transform, really transform lives. When I think about the work that we're doing for CASA. A number of them, there's some immigration advocacy work that we're doing there through ICE, through some clients that have been seen there, and we're able to do some of that work. Families that have been impacted by some of that work. And so we're able to see them, we're able to provide bilingual counseling. And it's been transformative for those families to have an opportunity. We have a number of counselors that are able to provide support for them. That's been transformative in services that they would not have been able to receive services, a shortage of clinicians in that area. And so we're able to fulfill a need that clients in that area they would not have been able to receive if it weren't for the Virtual Clinical Training Center. And we're so grateful and thankful that we're able to provide that service for that area, for that population.
Thank you for sharing. It's such innovative work. It's a modality that will continue to grow and hopefully continue to bridge those gaps and getting into communities that couldn't typically get these services. Rodney, you're responsible for a lot of community members, a lot of students. You're doing complex work. You're doing, if I can say, some heavy emotional work too. How do you stay grounded? How do you stay motivated to continue doing what you do?
So two things. One of the things I do, Alicia, and you'll find my neighbors will tell you that I circle the block. So I do a lot of walking in my neighborhood. And my wife will tell you that when I'm circling the block and I'm walking, typically that's my way of grounding myself. And so that means something may have happened inside this house, and I need to circle the block, and I need to ground myself, and I need to breathe. That happens several times a day. So usually I get my steps in.
I like it.
And so that's one of the ways that I'm able to do that. I also am able to, it's good to stay in contact with family. It's good to able to stay in contact with family, daughter, my mom, family members that keep me grounded and remind me, Alicia, before I was Dr. Harris, way back when I was, remind me that I am still Rodney, so that is, such an important part of the work I do. And then, I just something else that's been transformative. I'm glad you asked me this question. And I have struggled with this, and I'm getting much better at this probably in the last 2 years. My ability to ask for what I need and to recognize my limits. I struggle with that and would stay up, 3, 4, 5 o'clock in the morning, doing everything, all the time. And I have learned to ask for what I need, professionally, and even from an advocacy perspective, Alicia, I think recognizing, even with my work with Blue Cross, that sometimes it's easy for me to ask for the money for somebody else. It's easy for me to ask for the money. It's easy for me to do that. And at first, I wouldn't do it. I was like, these barbers need this money, and I've developed the skills and to be able to say, hey, Blue Cross, I need this money for these barbers, and to being able, as a point of advocacy, to say and to speak up for myself and to have voice, to be able to say, let me translate these skills to say, hey, you guys got this money. Give it up. Give it to someone that's doing worthwhile work in the community. I'm not out here stealing it. I'm doing worthwhile work. I'm doing good work out here, and learning to speak up and be forward. I think what you and I just talked about, being forward facing and not being the person that's behind, behind the scenes, and saying, this is my work. Did I take some responsibility for it? And putting my work on the news, putting my work in the paper, and even having some friends, in the newspapers, and saying, look, hey, I'm doing this program, I'm doing this, there's a Narcan story I had last week, and we saved somebody's life where someone collapsed outside of a barbershop, and they remember I gave out Narcan, and they gave it to someone that saved somebody's life. And I called the news reporter. I was like, look, I need you to cover this story for me. Go out there come to the news or come to the barbershop, and I need you to cover this story. So learning, it's important, that we do the work, but it's also important for a couple of reasons that we translate this work. We publish this work.
Right.
You guys have been getting on me about that. So I'm becoming
know.
better about it. I'm getting it. I promise you, because you've been getting on me about publishing this work. And so that
Yes.
I publish this work, but also that I put the work out there. So I'm learning, to create that balance. It's important for me to do the work, but I got to publish what I'm doing. Also, the other piece of that, it's important for me to put it out there on the media. And so I've been really being conscious of that and not just being like, okay, I did it. But it's important that I get that story out there.
Yes, I 100%. And you let me know what you need, Rodney, okay?
You always come through, Alicia. You did.
Okay, Rodney, my last question for you, my friend. As we step away from our titles and our roles in this conversation, what's one thing you hope people better understand about advocacy, counseling, and community healing, and why it matters beyond the therapy room?
Yeah. I think number one, that it is number one, it's mandated by our codes. I think that's important for us to recognize that. I think number two, the responsibility of advocacy. And three, that if we don't do it, nobody will. And so I think oftentimes we want to, it would have been easy, like as my mentor said, to sit in that very sterile, clean office and see clients, and, day in and day out and not get outside the office. And I think I'm thankful for that challenge to get me outside the office and go into community and help people. And, I think about that guy who, the Narcan saved his life, and if I think if that one thing, that one person to save, but for that instant, if I would have stayed in my very sterile, clean office, perhaps he would have been dead.
Yeah. Rodney, you truly walk the walk as an engaged practitioner, as someone who works in the community. You are far too humble for the work that you do. And I just want to say how much I appreciate you and thank you for the work that you're doing in the community and bringing it back to the mission and vision of the Chicago School and showing students how you walk that walk in the community. So thank you. Thank you for our time together. I think we could talk all day about this. So I appreciate it.
Okay. Thank you.